Hello, everyone, and welcome to our presentation on over-the-counter medications for allergic rhinitis. Next slide, please. So what is allergic rhinitis? It's a type of airway allergy, also referred to as hay fever, and it can be divided into seasonal and perennial, and your seasonal is things like pollen or weeds, and perennial is things like dust or mold or foods. So just a little bit about the pathophysiology. Your first exposure to the allergen causes IgE production, and then this IgE binds to the mast cells, so it's fixed in the tissue. And then when you're exposed again, the antigen binds to the IgE, causing mast cells to break down and release some different mediators, including histamine, which histamine results in most of the signs and symptoms of allergic rhinitis because it causes vasodilation and increased mucus production. Next slide, please. So some signs and symptoms of allergic rhinitis include inflammation of the conjunctiva, itching of the eye and nose, fatigue, rhinorrhea, and nasal congestion. Next slide, please. So a couple of non-pharmacologic methods for treatment. We want our patients to avoid allergens if possible, which of course, depending on the allergen, is not always possible. But there's a couple different ways to reduce exposure to allergens, and these methods are kind of dependent on what exactly they're allergic to. So things like keeping the windows closed, using a dehumidifier, washing their bedding often, and using an air purifier. Next slide, please. Okay, so we're going to talk about a couple over-the-counter drug classes. Next slide, please. So we're first going to talk about the first generation antihistamines. They're also H1 receptor blockers. The main one in this class is diphenhydramine or Benadryl. So this medication blocks the action of histamine at the receptors. Side effects, the big one is sedation. It can cause a lot of sedation. It actually can cause the opposite in PEDS patients. It can cause them to be more hyperactive. And then we see anticholinergic side effects with this because it also blocks the cholinergic receptors. The drug-drug interactions, the big one is CNS depressants. We want our patients to avoid using this with any other CNS depressants. And then this does also have the potential for abuse. And because of the potential for abuse and the side effects, there is actually cause for this to be taken off the market. As far as special populations, this is contraindicated in breastfeeding women because it can pass through the breast milk to the baby, and it can also cause some issues with milk supply. And then it's contraindicated in our patients with narrow angle glaucoma or BPH, again, due to those anticholinergic side effects. And the big one is the elderly patients. Should avoid this entirely, and we'll talk a little bit about medication safety issues later. But it is okay to use in pregnancy. Next slide, please. So our second and third generation antihistamines are also called non-sedating antihistamines. There's a couple different medications listed here for you, but these again block the action of histamine, but they are more selective than the first as far as the receptors that they block. So they don't cause as many side effects. You can see a couple listed here, but they're generally more well tolerated. Couple drug-drug interactions. These are specifically for fexofenadine. You can see those here. And as far as special populations, again, they're not recommended in breastfeeding women. And again, they are okay to use in pregnancy. But our patients with renal and hepatic disease, because these medications are renally cleared, and some of them are metabolized by the CYP450 enzymes. If patients have renal or hepatic impairments, dose adjustment is required for those populations. Next slide, please.
Yeah, moving on to the intranasal antihistamines. Medication in this class include drugs like azelastine, marketed as Astapro. The mechanism of action is that it blocks histamine 1 receptor, so it's a H1 receptor antagonist. Adverse effects associated with the use of this medication include a bitter or metallic taste in the mouth. Nasal irritation and epistaxis have been recorded due to improper technique in using the devices. Dry mouth, eye irritation, and nausea have been recorded as well. Similar to the first and second generation antihistamines, drug-drug interaction with antidepressants, antipsychotics, and even some anti-epileptics can cause an additive CNS depressive effect. Special care also has to be taken in the elderly, and high dose or prolonged use is also high. It's advised to avoid high dose or prolonged use in individuals that have hepatic and renal impairment, just due to the effect of the cytochrome P450 enzyme on these medications.
Right, and then we move on to our topical decongestant, the intranasal medications like Ephren. They work by causing vasoconstriction and stimulating adrenergic receptors, causing narrowing blood vessels, reducing swelling in the mucous membrane and the nose and the eyes. So one of the first main concern with this medication, it's rebound congestion with prolonged use, and also systemic effects with those medication being alpha adrenergic medication to palpitation, tachycardia, drug-drug interactions, antidepressants, MOA inhibitors, TCAs, tricycle and antidepressant, beta blockers, and those medications, also CNS stimulation and kidney failure at large dose um, can be caused. Dosage form, they are nasal spray. Specific population are people I I severe hypertension, heart disease, and urinary problems in those medications. And the recommended dose is usually 3 to 5 days and 1 to 2 spray. Then we move on to our decongestants. Phenylephrine, pseudoephedrine, those medications, they act on the adrenergic receptors, causing vasoconstrictions of the nasal mucosa, so leading to reduced swelling and congestion, improving breathing. Adverse events would be anxiety, dizziness, headache, insomnia, blood vision only with epinephrine, and drug-to-drug interaction with our MAOs, tricyclic antidepressant as well, and blood pressure medications. And digoxin, I just wanted to point that out for pseudoephedrine. These medications, specific population, again, a population-wide show hypersensitivity for those medication, severe hypertension, severe COD, people who've been on MAO medication therapy for inhibitor therapy for 14 days. And this medication should not be given to children under 6 years of age, pregnant women. And I have to say, phenylephrine is not rarely used nowadays for rhinitis because it's not a very efficient medication because it has to go to the first pass metabolism and it gets destroyed before it reaches its target. So it's not really effective. With pseudoephedrine, I want to point out that this medication, due to the severe side effects, and abuse for manufacturing amphetamine is not really dispensed over the counter. You need to go to the pharmacist to show ID because it's federally regulated. And then we move on to the next slide.
Right, and I'll be discussing intranasal corticosteroids. A good example is fluticasone, which is also known as Flonase. It basically works as an anti-inflammatory, basically reducing mast cell stimulation by inhibiting cells that present antigens to antibodies. Some adverse effects include headache, nasal irritation, bleeding, and even septal perforation. Again, because this isn't a systemic corticosteroid, it's very locally used. The drug-drug interactions are minimal, but still to note, especially for Flonase, ritonavir is a drug-drug interaction that should be looked out for. In terms of special populations, this is a relatively safe drug, but for pediatrics, it can delay growth for children. And for pregnant individuals, it's still inconclusive, so it should be discussed with your doctor before use, but relatively still a safe drug. In terms of for intranasal cromolyn, its mechanism of action is a mast cell stabilizer, and basically its adverse effects include sneezing and stinging cessation. Again, relatively safe drug very like no known drug interactions that were found on micromedics. And again, for special populations, it's very inconclusive in terms of evidence for pregnant or breastfeeding individuals, but seen as relatively safe. But always talk to your doctor before taking this medication if you're pregnant or breastfeeding.
Some prescription medications are available that can be taken when all these other therapies have failed, and these include immunotherapy with sublingual tablets like Orale, Singulair, Ipratropium, the first and second generation antihistamines.
Sorry, I had to unmute myself. So as far as medication safety issues, one issue that we identified was that none of the generic or brand name Benadryl products actually contained any caution against use in older adults. Um, and again, older adults should avoid these medications due to their sedating and anticholinergic side effects. And you can see here, there's a couple, especially that people at risk of delirium or with a history of falls or dementia should especially avoid these. So as far as methods for prevention, I mean, ideally these drugs would be labeled with caution to avoid. Interestingly, Zyrtec is actually labeled with a caution for older adults, but educating patients or their caregivers to select one of our newer antihistamines that don't have as much of those side effects, or to use like one of our non-pharmacologic methods. Next slide, please.
Yeah, medication safety issues with the intranasal antihistamines is usually associated with improper technique or use, which can cause epistaxis or mucosal irritation in patients. To prevent this, it's just to educate our patients on proper use, which we can start by demonstrating the right technique and allowing the patient use it in front of the provider before leaving the clinic. Other medication safety issues, as we mentioned, with regards to additive CNS depressive effect. So to prevent this is to educate the patient to avoid alcohol use or driving or operating machinery while using this medication.
So as far as costs, just a little bit of information for you here. I just want to highlight that Benadryl is pretty inexpensive. About a 100-day supply generic at Target was $4. And this medication is taken every 4 to 6 hours. And then for our second generation antihistamines like Zyrtec, at Target, the 30-day supply of the generic was about $6. And that medication is taken just once daily. Next slide, please.
Oh yeah. So similarly, for Flonase, the cost is around $15 to $25. And but surprisingly, is this right? Surprisingly, intranasal cromolyn is used it's costs about $20. Sorry.
And for the intranasal antihistamines, they're a little on the high side. The price for Astapro ranges from $21 to $36 at CVS pharmacy. And for Patanase, it can get up to $40 and about 50 cents for a 30.5-gram bottle at CVS pharmacy. So these ones are a little on the high side. And with this is the end of our presentation. Thank you.